Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A pregnant client with severe preeclampsia is receiving 4 magnesium sulfate. What should the nurse keep at the bedside to prepare for the possibility of magnesium sulfate toxicity? A. Oxygen. B. Naloxone. C. Calcium gluconate. D. Suction equipment. The answer is option C, calcium gluconate. 2. A person who is hospitalized for alcoholism becomes boisterous and belligerent and verbally threatens the nurse. What is the most appropriate response by the nurse? A. Place the client in restraints. B. Sedate and place the client in a controlled environment. C. Encourage the client to play ping pong with another client. D. Set firm limits on the client's behavior and enforce adherence to them. The answer is option B, sedate and place the client in a controlled environment. 3. A nurse is caring for a client who is receiving a thiazide diuretic for hypertension. Which food selected by the client indicates to the nurse that dietary teaching about thiazide diuretics was effective? A. Apples. B. Broccoli. C. Cherries. D. Cauliflower. The answer is option B. Broccoli. 4. During the first well baby visit after discharge from the hospital, the parents inform the nurse that their baby has difficulty sucking and swallowing and tires easily. What should the nurse consider when assessing this infant? A. Newborns tend to tire easily, especially when feeding. B. Decreased sucking is insignificant in the absence of cyanosis. C. Difficulty when feeding may be an early indication of a heart defect. D. Some infants retain mucus for several days that may interfere with feeding. The answer is option C, difficulty when feeding may be an early indication of a heart defect. 5. For which clinical indicator should the nurse monitor a child with chronic hypoxia? A. Clubbing of fingers. B. Slow, irregular respirations. C. Subcutaneous hemorrhages. D. Decreased red blood cell count. The answer is option A, clubbing of fingers. 6. A nurse is caring for a client with a fracture of the head of the femur. The healthcare provider places the client in a buck extension. What explanation does the nurse give the client for why the traction is being used? A. Reduces muscle spasms. B. Prevents soft tissue edema. C. Reduces the need for cast application. D. Prevents damage to the surrounding nerves. The answer is option reduces muscle spasms. 7. A client has a total hip arthroplasty. What should the nurse do when caring for this client after surgery? A. Use a pillow to keep the legs abducted. B. Elevate the client's affected limb on a pillow. C. Turn the client using the log rolling technique. D. Place a trochanter roll along the entire extremity. The answer is option A, use a pillow to keep the legs abducted. 8. Which client in a psychiatric unit needs immediate therapeutic intervention from the nurse? A. 50-year-old woman who is pacing around the day room and picking fights with other clients. B. 25-year-old man who is making sounds and actions like a machine gun in front of the nurse's station. C. 45-year-old man who sits quietly in the corner of the room, watching the movements of other clients. D. 33-year-old woman who wanders aimlessly around the unit, saying, "I just don't know what to do. I feel so lost." The answer is option A, 50-year-old woman who is pacing around the day room and picking fights with other clients. 9. A client in a psychiatric hospital with the diagnosis of major depression is tearful and refuses to eat dinner after a visit with a friend. What is the most therapeutic nursing action? A. Allow the client to skip the meal. B. Offer an opportunity to discuss the visit. C. Reinforce the importance of adequate nutrition. D. Provide the client with adequate quiet thinking time. The answer is option B. Offer an opportunity to discuss the visit. 10. A person with a history of alcoholism states, "I have been drinking since last Friday to celebrate my son's graduation from college." What defense mechanism does the nurse identify the client is using? A. Projection. B. Suppression. C. Identification. D. Rationalization. The answer is option D, rationalization. 11. The parents of a child with spasmodic croup ask why their child is receiving humidified oxygen. What effect of humidified oxygen should the nurse include in the explanation? A. Minimizes tissue edema. B. Provides a mode for giving inhalant drugs. C. Increases the surface tension of the respiratory tract. D. Provides an environment free of pathogenic organisms. The answer is option minimizes tissue edema. 12. A client has a surgical creation of a colostomy. What is the most effective nursing intervention to initially help the client accept the colostomy? A. Introduce equipment needed to care for the colostomy. B. Provide literature containing factual data about colostomies. C. Ask a member of a support group to come to speak with the client. D. Point out the number of important people who have had colostomies. The answer is option A. Introduce equipment needed to care for the colostomy. 13. When planning care for a child with autism, nurse understands that given a choice, the child with autism usually enjoys playing A. On a jungle gym. B. With a cuddly toy. C. With a small yellow block. D. On a playground merry-go-round. The answer is option D. On a playground merry-go-round. 14. A client who is at 26 weeks gestation arrives at the clinic for her scheduled examination. Her blood pressure is 150/86. That she tells the nurse that she has gained 5 pounds in the last 2 weeks. What is the priority nursing action? A. Test the client's urine for albumin. B. Take the client's body temperature. C. Prepare the client for a vaginal examination. D. Schedule the client for an appointment in a week. The answer is option. Test the client's urine for albumin. 15. What behavior does a nurse expect of a newborn about 1 hour after birth? Crying and cranky. B. Hyperresponsive to stimuli. C. Relaxed and sleeping quietly. D. Intensely alert with eyes wide open. The answer is option C. Relaxed and sleeping quietly. 16. A client who has a phobia about dogs is about to begin systematic desensitization. The client asks what the treatment will involve. What is the nurse's best response? A. You will be exposed to dogs until you no longer feel anxious. B. Rewards will be given when you do not become anxious around dogs. C. Your contact with dogs will increase while using relaxation techniques. D. There will be in-depth discussions to identify what caused your phobia. The answer is option C. Your contact with dogs will increase while using relaxation techniques. 17. A nurse is providing dietary teaching for a client who is receiving a high-protein diet while recovering from an acute episode of colitis. What should the nurse include as the rationale for this diet? Repairs tissues. B. Slows peristalsis. C. Corrects the anemia. D. Improves muscle tone. The answer is option A. Repairs tissues. 18. A nurse is caring for a client experiencing an acute episode of bronchial asthma. What outcome should be achieved? A. Erasing mucus secretions from the chest. B. Curing the client's condition permanently. C. Limiting pulmonary secretions by decreasing fluid intake. D. Convincing the client that the condition is emotionally based. The answer is option A. Raising mucus secretions from the chest. 19. When a developmental appraisal is performed on a 6-month-old infant, which observation is most important to the nurse in light of a diagnosis of hydrocephalus? A. Head lag. B. Positive Babinski reflex. C. Inability to sit unsupported. D. Absence of the grasp reflex. The answer is option A. Head lag. 20. A new mother refuses to look at her newborn who has a severe birth defect. What is the nurse's most therapeutic approach? Request that the family try to distract her. B. Clarify why she should stop blaming herself for the baby's handicap. C. Reinforce the explanation of the handicap and allow time for her to discuss her fears. D. Wait until she has sufficiently recovered from the stress of birth and then bring the baby to her again. The answer is option C. Reinforce the explanation of the handicap and allow time for her to discuss her fears. 21. When teaching a class about parenting, the nurse asks the participants what they do when their toddlers have a temper tantrum. Which statement demonstrates one parent's understanding of the origin of temper tantrums? A. After a temper tantrum, I discipline my child by restricting a favorite food or activity. B. When a temper tantrum begins, I isolate and ignore my child until the behavior improves. C. During a temper tantrum, I partially gives in to my child before the tantrum becomes excessive. D. I try to prevent a temper tantrum by allowing my child to choose between two reasonable alternatives. The answer is option D. I try to prevent a temper tantrum by allowing my child to choose between two reasonable alternatives. 22. A nursing assistant interrupts the performance of a ritual by a client with obsessive-compulsive disorder. What is the most likely client reaction? A. Anxiety. B. Hostility. C. Aggression. D. Withdrawal. The answer is option anxiety. 23. When a nurse is working with a client with psychiatric problems, a primary goal is the establishment of a therapeutic nurse-client relationship. What is the major purpose of this relationship? A. Increase nonverbal communication. B. Present an outlet for suppressed hostile feelings. C. Assist the client in acquiring more effective behavior. D. Provide the client with someone who can make decisions. The answer is option C. Assist the client in acquiring more effective behavior. 24. An African American woman is diagnosed with primary hypertension. She asks, is hypertension a disease of African American people? What is the nurse's best response? A. The prevalence of hypertension is about equal for women of all races. B. The higher risk population is composed of African American men and women. C. The highest risk population consists of older Caucasian American men and women. D. The prevalence of hypertension is greater for African American women than for African American men. The answer is option B. The higher risk population is composed of African American men and women. 25. A healthcare provider prescribes a diuretic for a client with hypertension. What should the nurse include in the teaching when explaining how diuretics reduce blood pressure? Facilitates vasodilation. B. Promotes smooth muscle relaxation. C. Reduces the circulating blood volume. D. Blocks the sympathetic nervous system. The answer is option C. Reduces the circulating blood volume.
Thank you for watching.